This is Speaking of Health, brought to you by St. Vincent Health.
Hello, my name is Dr. Morgan Sauer, and today we're having our first episode of Speaking of Health. I would like to tell you about a breakthrough procedure for kidney stones. I'm speaking not only as a physician, but also as a patient who's recently undergone this procedure. It's called ESWL, or extracorporeal shock wave lithotripsy. That's a big name for a procedure that dramatically reduces the time and pain associated with kidney stones. ESWL uses high-energy shock waves to reduce the stones, sometimes to as small as a grain of sand. These stones are easily passed and no surgery is needed. In many cases, like mine, it's done on an outpatient basis. Dr. Brizzolera explains.
The advantages of extracorporeal shockwave lithotripsy, or ESWL, it does not require an incision like we usually think about when we think of surgery. Most people, after they have had the treatment, will get back to work within the next 2 to 5 days. Patients can usually expect some discomfort on the side that has been treated, and most of the time the pain is controlled with oral pain medication. It's rare that somebody has to be admitted to the hospital for pain control. Some patients, when they have extracorporeal shockwave lithotripsy, will require what's called a stent, which is a hollow tube that runs from the bladder into the kidney, and this facilitates the passage of the stone fragments. It's extremely successful. The majority of stones that are located from the middle of the ureter, which is the tube that drains the kidney, up to the kidney, are treated with extracorporeal shockwave lithotripsy. Obviously, the extracorporeal shockwave lithotripsy is less invasive, and it's the preferred treatment for stones in the appropriate position.
To learn more about extracorporeal shockwave lithotripsy, go to stvincenthealth.com.
This has been Speaking of Health, brought to you by St. Vincent Health. Join us again next month to learn about another topic important to your health.